welcome to my neurological assessment video. My name is Julie Kinhart and I'm a student at HERZING University. And this is my patient today, Riley Nagler. Riley, how old are you?
I'm 18.
She's 18 and we are going to be doing a neurological assessment. So I am going to go ahead and I am going to wash my hands with some hand sanitizer. Do you want to wash your hands?
Sure.
Okay. So what we're going to be doing today is we are going to be testing her neurological system and we're going to do an assessment. So first what we're going to do is we are going to assess her cranial nerves 1 through 12. Okay, Riley, is that okay?
That's fine.
Okay. So the first one that we are going to do is we are going to test your olfactory, which is cranial nerve number 1. Okay?
Okay.
So the way that we're going to do this is I want you to put your finger on one side of your nose. Okay? And can you breathe through the other nostril for me? Okay. Now I want you to try the other one. All right. And that's Peyton, and you can breathe pretty well?
Yep.
Okay. All right. Let me get our supplies. All right. All right. So what we're going to be doing is I am going to have you go ahead and put your your finger on one side and close your eyes for me. Okay. So I'm going to put something underneath your nose with your eyes closed, and I want you to smell it and tell me what you smell. Okay?
Gum.
Good. Okay?
Lemon.
Perfect.
Vanilla.
Perfect. All right, so now we're going to go ahead and we are going to try this on the other side, okay? All right.
Vanilla.
Okay.
Gum.
Okay.
Lemon.
Lemon. Perfect. So she has passed her neurological assessment for her cranial nerve number 1. So that is intact that we know of. So next that we are going to do, we are going to test her cranial nerve number 2, which is her optical. So the way that we are going to do this is that I'm going to go ahead and I'm going to have you cover one of your eyes, okay? And maybe the best way to do this is to kind of just scoot like this. Okay. So I'm going to have you look at me, okay? And I'm going to hold fingers up. And I want you to just keep looking in this eye. And I want you to tell me how many fingers I'm pointing.
Okay.
Okay. All right. Go ahead and just keep looking at me, Miss Riley, okay? Okay. Keep your eye open. Okay. How many fingers am I holding?
2.
Okay. And what about now? And what about
4.
now? Okay. Great. Okay. So now what we're going to do is we're going to do the other side. Are you ready?
Yeah, I'm ready.
Okay. All right.
2, 4, 3.
Perfect. Okay. She has gone ahead and she has passed that one. So her optical cranial nerve number 2 is intact. Okay. So next that we're going to do is we are going to test cranial nerves 3, 4, and 6. And those are the oculomotor, the trochlear, and the abductans cranial nerves. So I'm going to go ahead and I'm going to get a pen light. All right, Riley. And what we are going to do is I want you to look straight ahead. Look straight ahead. Do you see that light in that camera?
Yes.
Okay, I want you to imagine that you are just looking straight at that. Okay, so we are going to go ahead and I'm going to turn this light off. Okay. And I am going to shine a light, okay?
Okay.
All right. All right, so your right eye constricts and it looks great. We're going to try the other eye. All right, that looks great. Okay, so her eyes, they were equal. Her pupils were equal reactive to the light and they did really great. So next that we're going to do is we are going to do the 6 gazes. And this is going to, again, test those 3 same nerves, cranial nerve 3, cranial nerve 4, and cranial nerve 6, okay? All right, so what I want you to do, Riley, is you are going to just look at this light, okay? And I want you to keep your head pointed forward, and we are going to move this, okay? And I want you to follow with your eyes.
Okay.
Do not follow with your head, okay?
Okay.
All right, so go ahead and look at this. All right, you ready?
Yes.
Okay. All right, great. So far she has passed that and she has done great. The next one that we're going to do is accommodation. All right, so what I want you to do is I want you to take a look at this,
Okay.
and you're just going to follow this pen light in, okay?
Okay.
You don't need to think about it. We're just going to see, make sure that those cranial nerves are intact, okay?
Okay.
All right, you ready?
Yes.
All right, so she did great because her eyes crossed the closer it got to her, so that tells me that those nerves are intact. And I'm going to go ahead and turn the lights back on just because we're not doing her pupils right now. All right, so what we're going to do now is we are going to test cranial nerve number 5, and that is the trigeminal, okay? So what we're going to do is we're going to feel her temporal muscles, and they're great. And her jaw muscles, they are great. Now next, what we are going to do, Riley, is we are going to test this jaw muscle and see if you have any resistance to it. So what I'm going to ask her to do is she's going to open her mouth up. Sorry, the camera keeps freezing. She's going to open her mouth up, and we are going to see if she has any resistance. Okay, so go ahead and, perfect. So that nerve is perfect and it is intact, okay? All right, so the next one that we're going to do is we are going to test cranial nerve number 7, which is her facial. So how we're going to do this is I want you to smile real big for me so I can see your teeth. Perfect. Now I want you to puff up your cheeks like a chipmunk. Okay. Now can you raise your eyebrows real big? Okay, you do not have to do both at the same time, but that works. We know everything's still working. I want you to frown for me. Okay, all right. And then I want you to close your eyes real tight. Okay, perfect. So we know that those cranial nerve number 7 is intact. So next we're going to do cranial nerve number 8, which is acoustic. So we are going to do this. I'm going to whisper something in each ear. Okay? It's either going to be a number, a letter, or a word. And then I'm going to ask you what I said, okay? All right, so we're going to go ahead and start. I'm going to cover this ear. And I'm going to whisper something in this.
Apple.
Okay, so that ear we know is great. Let's try the other one.
Banana.
Okay, so she passed that, and we know that her cranial nerve number 8 is totally intact. Okay, so we are going to do glossopharyngeal. So what I want you to do is I am going to put this on your tongue, and I want you to stick it out and go ah.
Ah.
All right, hold on, let me just take a look.
Ah.
Okay, and her uvula went up, so we know that that is intact. And now we're going to test your gag reflex. Now this is not comfortable, so I apologize, okay? Okay, her gag reflex is definitely intact. So the next one that we are going to do is we are going to test her vagus nerve. The light keeps going dim and I can't see. We're going to test her vagus nerve. So Riley, do you have any difficulty swallowing?
No.
Okay, do you feel hoarse at all?
No.
Okay, so we know that her cranial nerve number 10, which is her vagus, she is intact. Okay, so the next one that we are going to do is cranial nerve number 11, and those are her accessory muscles. Okay, so what I want you to do is I want you to move your head to each side, okay? And I'm going to remove my head. All right, so then we are also going to go up and down. Okay, and I'm going to move my hands. Okay, all right, so far we're doing great, and she seems intact in that cranial nerve. So what I want you to do now, Riley, is I'm going to push a little bit, and I want you to shrug. Okay, so she is intact in that cranial nerve 11. So we are going to test the last cranial nerve number 12, and that's the hypoglossal. So what I want you to do, Riley, is to stick your tongue out, and I want you to move it side to side, and move it up and down. Okay, so that one is intact, so we know that she is doing great. So next thing we're going to do is we're going to test her coordination. So Riley, what I want you to do while you are sitting there, I want you to put your knees, and I want you to flap them, rapid alternating movements. Okay, so we know that she has great coordination because she's able to follow those directions and do that with no difficulty. Okay, so next that we are going to do is we're going to do the Romberg test, okay? So Riley, can you go ahead and step down for me? Okay, so the Romberg test. So this is going to test to make sure that she is coordinated, that she doesn't have any dizziness, vertigo. We are able to stand properly. Okay, so Riley, what I want you to do is I want you to just stand here. I want you to put your feet together and your hands at your sides. Okay, and I want you to just stand up nice and straight. All right, so far she's looking great. She's not having any dizziness, any vertigo, or anything like that. All right, next what I want you to do is I want you to close your eyes. All right, so with her eyes closed, she has done great so far. Next, what I want you to do, Riley, is I want you to keep your eyes closed and I want you to put your hands up and your palms facing up. All right, so she's gonna stand like this for a couple seconds and we're just gonna make sure that she's doing okay. All right, so far she's doing great. Riley, we're gonna stand here. I'm gonna push down with your hands a little bit, okay? And we're gonna see what your arms do. Okay, so I pushed down a little bit and they did have a little bit of a drift, but they came right back up, which is exactly what she's supposed to do. Okay, Riley, so what I want you to do now is I want you to start over here and I want you to walk back and forth 4 times, or yeah, 4 times. All right, so that is great. So I think that her coordination is great. She has great coordination. Her gait is steady. She does not have any weakness that we can see of, so she passes her gait test. Okay, so Riley, you can go ahead and sit back down. All right, so what we are going to do now is we are going to test dull, sharp, and soft, okay? So what we're going to do is I'm going to go ahead and you are going to close your eyes. You're going to put both your hands out for me. Okay, and how we're going to test this is I want you to tell me, is this dull or is this sharp, okay?
Okay.
All right. Out. Okay.
Sharp. 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 Sharp.
Okay, so that's great. So we're going to do it again. All right.
Soft. 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 Soft.
Okay. All right, so we're going to go ahead and do this again. All right.
Dull. 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 Dull.
Okay, great. Okay, so we have gone ahead and we have passed that. She did great. Let me turn this back on. Sorry, guys. Okay, so now we're going to do a vibratory response. So what we're going to do is I'm going to put a tuning fork over her bony prominences, and she's going to tell me when it stops. Do you feel that vibratory?
Yes.
Okay. Can you tell me when it stops?
It's up.
Okay. All right, we'll do this one. Do you feel it vibrating?
It stopped.
All right, we're going to go down here.
Stop.
Okay.
It stopped.
Okay. All right, great. So far she is doing great and she has passed that. So next that we are going to do is we are going to test some familiar objects. So Riley, what I'm going to do is I'm going to have you close your eyes in just a minute,
Okay.
and I'm going to put an object in your hand, and I want you to tell me what you think it is, okay?
Okay.
All right. So go ahead and close your eyes for me. All right, what is that?
It's a phone.
Okay. All right. Perfect. Okay. So she passed that and she did great. Okay, let me just grab my. Okay. All right. All right. So what we're gonna do is we're gonna do a 2-point discernment test. Okay. So I want you to go ahead and I am going to touch your hand with an object, and I want you to tell me if you're being touched twice or once. Okay. All right.
Twice. Once. Twice. Once.
And we're going to do the same thing over here.
Twice. Twice. Twice.
All right, so Riley has gone ahead and she has passed that. She was able to discern on both sides whether or not I was touching her once or twice. And when you are 6 millimeters apart, then you can feel the difference. Closer than that, they really are not able to feel the difference between 1 or 2. Okay, so next what we're going to do, Riley, is I'm going to draw a number or a letter in your hand with your eyes closed, and I want you to tell me what you think it is, okay? All right. So go ahead and close your eyes for me. All right.
H.
Yeah. All right. So this is going to be a number. So I want you to tell me what you think it is.
3.
Perfect. All right. So she is passed. She's doing great. Okay. So next that we are going to do, Riley, is I'm going to have you close your eyes, and I'm going to touch an area of your body, and I want you, when I tell you to open your eyes, I want you to tell me what you think I touched. Okay?
Okay.
All right. So go ahead and close your eyes. All right. What am
My
I?
knee.
Okay.
My knee.
Okay.
My back.
Okay.
My hand.
Okay, so she passed and she did great. Okay, Riley, next what we are going to do, we are going to test your reflexes, okay?
Okay.
All right, so we are going to test your tricep, your bicep, and your brachial brachial radius reflexes, okay? All right, so we are going to do your brachial, or your bicep first, so we're going to go right here. All right. Okay, all right. So that was intact, and we are going to go ahead and do her tricep right now. Okay. All right. So we know that that is intact and it is healthy. So next we're going to do her brachial reflex. Okay. Are you ready?
Mhm.
All right. So actually, we'll do it right here with your hand a little bit over your lap. Okay, so we know that on the left-hand side, she looks good and she is able to have those great reflexes. All right, so we're gonna move on over here to the other side. All right, we're gonna do the exact same thing. The brachial radial, or brachial reflex, the bicep, which is gonna be right here, and the tricep, which is gonna be right here. Okay, all right, you ready?
Yep.
All right, so the bicep one works. Okay, and then we're gonna go right here. All right, great. All right, so next that we are going to do is we're gonna do her patellar reflexes, okay? Are you ready?
Yep, I'm ready.
All right. All right, so her right works great. Let's do her left. Okay, so we know that one works as well. Okay, so next, Riley, what we're gonna do is I'm gonna have you lay flat for me. Okay, just scoot up a little bit. Sorry, my kitchen isn't quite conducive for a doctor's office. All right, so next what we are going to do is we are going to test her abdominal reflexes. Now, I will tell you she has a ticklish stomach, so we're gonna do the best we can. But I'm just gonna lift your shirt up, Riley, okay? I'm gonna pull your pants down just a little bit. Okay. She's very ticklish. She's been like this forever. All right, so I'm going to go ahead and I'm going to see your reflexes. All right, so her abdominal, it's looking like she has really good reflexes, and we're going to go like that. So essentially what we're doing is I'm going up, or I'm going down, down, in, and in, making sure that she has good abdominal muscle reflexes, which she does. And you can tell by her laughing, she's got great abs. Okay, all right, so next, Riley, what we're gonna do is I am going to test your foot reflex, okay? Let me just turn this back on. All right, are you ready?
Yes.
Okay, so we know her left works great. Okay, and we're gonna do her right. All right, just calm down. Okay, so we know that one works great too. So next we're gonna test her ankle quantness. So, and this is the last part, Riley, so you're almost done, okay? All right, so I am going to push her foot towards her and release, and we're gonna make sure that she doesn't have constant involuntary movements after, okay? All right, 1, 2, 3. Okay, so her left, she's negative for that. All right, we're gonna do the same thing on the right, okay? All right, great. So her ankles were nice and still, and she has done great. So Riley, I'm gonna go ahead and help you back up. All right, so thank you so much for helping me today and letting me assess you. You did great, and I hope you have a wonderful, great rest of your day. Thanks so much.
Bye.
Bye.